I want you to actually do this yourself. So I want you to take one of your hands, and I want you to put it on your wrist. And I want you to open up your wrist and extend it like this. And I want you to flex it down. I want you to do it a couple of times, and you're going to feel these muscles kick on. Now, what I want you to do is I want you to wiggle your fingers like you're trying to play the piano. What you're going to see is that those muscles are literally one and the same.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
I'm not clear on how it's going to help my fingers. I see the wrist part all right, but I don't see how that's going to help me use my thumb and index finger, for example, to hold a nail.
Yep. Yeah, good question. So when this is actually, I'll take you back to the clinical trials really quickly. When we were doing these studies, we very much expected to see improvements that required gross motor function of like opening up, for instance, you're trying to open up and pick up a cup of coffee, right?
Yes.
But you'd imagine some improvements there.
That'd be a dream. Yeah.
And so when we did these studies, we expected to see those types of changes. And lo and behold, when we did see those changes. But we were also quite surprised insofar as we saw improvements in fine motor skills, such as one of the tests we do. Actually, there's two tests they're composite tests. They're composite outcome measures that we ask people to do a series of between 15 and 20 tasks. And what we do is we figure out if they can do them, one, and if they can do them, how long does it take them to do those tasks? And these tasks are quite complex insofar as one of them is like picking up a paperclip, a pencil, and sort of going up into more and more complex tasks, ultimately to picking up a shopping cart with a 10-pound weight in it effectively. So kind of a distribution of tasks. And what's really interesting is we saw improvements in fine motor skills as well, things that required fine motor function of the hand and the thumb. And that's interesting. And the question then is, well, how the heck could that happen? Because you're exactly right, Gary. With respect to the intervention itself, it is focused on this sort of gross motor activity of opening and closing the hand. Well, there's kind of two reasons why this is the case. Well, one of them I'm going to bring your attention, and that is the muscles that actually coordinate this task of opening and closing our wrist are literally the same muscles that allow me to do this, right? So I want you to actually...
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
I want you to actually do this yourself. So I want you to take one of your hands, and I want you to put it on your wrist. And I want you to open up your wrist and extend it like this. And I want you to flex it down. I want you to do it a couple of times, and you're going to feel these muscles kick on. Now, what I want you to do is I want you to wiggle your fingers like you're trying to play the piano. What you're going to see is that those muscles are literally one and the same. And it's just kind of cool. While there are what are called intrinsic finger muscles that help to control this motion here, they're also the majority of the muscles that actually control our wrist and our hand are the same ones that control our fingers. These are called extrinsic finger extensors and extrinsic finger flexors. So we're literally working on the same muscles, which is kind of cool. It's just about how you activate them. And so that's one component. The other component is the fact that when we give you access to this function of opening and closing your hand, what you end up doing is you end up integrating your hand back into more of your daily life, and you reverse this process of learned non-use. And this is really a common problem for individuals, especially with chronic impairments out past a year, where for you, for instance, you probably learned a lot about how to do tasks one-handed with your right side. Now that presents a complexity because what you do is you effectively de-emphasize the use of your left hand and you just preferentially use your right hand in this case. And what this does is we actually can sort of remind you that your left hand works. And what happens then is you start to integrate it back into your daily life and you begin to use it for more and more tasks. And that in itself becomes your rehab because all of those movements count. It's all cash in the bank for you to have better function. Now, the other kind of really cool thing, this is the third aspect, is actually kind of how the circuits are wired. The circuits are actually wired in our brains in much more of a functional network instead of just a simple isolated thing. So it's not like a wrist area per se. there's actually a functional area that actually coordinates these functional tasks. And so when we get activation across these segments, we end up getting simultaneous activation across the functional segments. So we get this sort of synchronous activation, if you will. And so there's kind of the three components to why we see improvements in fine motor skill. So hopefully that provides a little bit of explanation as to why the Motus hand is capable of inducing positive changes, not only about the wrist and the hand, these sort of gross motor tasks of opening and closing, but also of fine motor skills.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.